the next talk, I would like to remind you to leave all your questions in the chat box that we can discuss them with the speakers live after the fourth talk. Our next presenter is Professor Vera von Dossow from Bad Oeynhausen in Germany. She's head of the Department of Anesthesia there in the heart center at Bad Oeynhausen, which is one of the largest heart centers in Germany. And she has several academic and administrative appointments, published a lot of publications in highly impacted journals. She's an active member of several national and international societies, and also a board member of the subcommittee Transplant and Assist Device of the EACTA. And she's also the local program director, of course, of the EACTA Fellowship in Bad Oeynhausen. And her talk will about how to teach the non-technical skills and how to improve communication during an EACTA Fellowship. Vera, your talk, please.
Good evening, dear colleagues. Thank you very much for the invitation. My name is Vera von Dossow. I'm from Bad Oeynhausen in Ostwestphalia in Germany. And I would like to talk about how to teach non-technical skills and how to improve communication during the EACTA Fellowship. And let me start with high-risk industries, such as nuclear atom reactors or aircraft business, for example. They had lots of bad experiences, and then they developed high-risk industries developed security standards and normative values. So they try to improve the safety. Regarding medicine, we have the Hippocrates, first do not harm. And what does it mean for cardiac surgery patients? It came out with a circulation publication in 2030. It was Joyce Warr who gave a clear presentation of patient safety in the cardiac operating room regarding human factors and teamwork. So it is a safe, scientific and statement from the American Heart Association, and it refers to the human factor in cardiac surgery regarding errors and near misses in the high technology medical domain. This means we have the Swiss cheese. So if the patient enters in the hospital, there's a high hazard procedure and we have lots of failures of information, and at least the risk is death. So this is a fatal outcome that we have to prevent in any case. To improve quality in healthcare, this depends on several aspects. This includes safety, timeliness, efficiency, efficacy, equitability, and patient-centeredness. However, we have to keep in mind that today we have more subspecialties like anesthesiologists, intensivists, pediatric cardiac anesthesiologists. So we have larger groups and disparate roles, and the units have become greater. So it's important to improve teamwork and communication for a good quality outcome of the patients. So this means the ultimate objective should not be to avoid error or harm at all costs, but rather to achieve the best outcomes for the greatest number of sick patients. So the triple aim was published by the Institute of Healthcare Improvement 2011. This means improving the health of the population and enhancing the patient's experiences of care. This means that we have to improve quality care standard of education and reducing and controlling costs. What does it mean now for perioperative medicine and cardiothoracic surgery. It is important to have a clear and consistent communication. If you look at the teams which work together every day, so we have the cardiac anesthesiologist communicating with the perfusionist, with the cardiac surgeon, with the anesthetic nurses. So it's very important to have a clear and consistent communication. There are 6 approaches to improve teamwork. This means subspecialize and replace tribes with teams, sort out the leadership while flattening the gradients of authority, introduce explicit training in effective communication, to use checklist briefings and debriefings and engage in the process, and to promote a culture of respect alongside a commitment to excellence and focus on patients. And last but not least, to focus on the performance of the team and not on individuals. And then I would like to go a little bit more precise in these 6 approaches and give you some examples how to improve communication in a team. First of all, I would like to present you a very old sport called lacrosse, which was used by the Indians to prepare for the war. And these Indians, everyone was fighting for himself. And in the latest 19th, this was becoming a team sport in the universities of America. So this means for today that we have also these teams had a very high spirit, team spirit. And this was focused on a sport to play together and to have a commitment together. And today, this means that we have we need patient-centered teams. So it is important that also regarding the evolution of cardiac surgery, you see here we have Gabor, we have Lillehei, we have Christoph Barnard, who did the first heart transplantation. We have similar, parallel to this, the innovations of medical technologies, like the minimal invasive strategies, the TAVI procedures, the heart-lung machine, and also the LVAD implantation. So there has been an increasing amount of technology development. And this means also parallel and similar that the developments in cardiothoracic anesthesia were also important for the history of the whole anesthesia. So all advances that were developed in cardiothoracic anesthesia were promoted the monitoring and intensive care medicine today. And what you see here is the first deep hypothermia patient performed by Professor Dr. Zindler, who was the first professor of anesthesiology in the University Clinic of Düsseldorf. So we have lots of experiences parallel to the cardiac thoracic evolution. So also here, the EACTA is the umbrella of the subspecializing cardiothoracic and vascular anesthesia. But this means not only subspecializing in these different specialties, it means also a member of a heart team. There are several recommendations for a multidisciplinary team approach. This means also to the EACTA fellowship to receive the TE certification and to train on the TE simulator and the heart, lung, and machine team training. And in this context, also communication and non-technical skills are even important, like the other aspects. And I would like to give one example of a team. It is the Green Lane Cardiothoracic Unit. It was established by Brian Barrett in 1971. And this team was very special because it was small, highly subspecialized, and they had a commitment to consultant-led practice at all hours. And they had a culture of excellence, and they performed even cardiothoracic and vascular surgery, but also pediatric cardiac surgery. And all in this team, and this was they had a very high reputation and pioneering work in the use of homografts for aortic valve surgery and deep hypothermic arrest for congenital heart defects. And what was special in this team? In this team, it was special to have a small team, and every anesthesiologist and perfusionist surgeon participated in most aspects of the work, including postoperative intensive care. And they were supported from cardiologists and nurses and technicians, and the workload of many hours. So, however, even if they had a strong commitment, they were